Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Dr. Padmashri C.R. Chandrasekhar. He is a great donor, philanthropist, and more than that, he has served his whole life in the society. And not only that, he retired as the medical superintendent of Prestige of Nimhans. And even after retirement, at a ripe age, he's been keeping all his time for the improvement of the society. And today he is going to talk to us about the autism. In the past, we never heard about the autism. In the last a decade or two, we are hearing this autism very often. And every other child, we can't realize that it is autism. So whether we have to worry about autism, what is this autism and what is the treatment? Please tell us, sir.
So all of us know that the brain development starts when the child inside the mother's womb, 22 days or 23 hours age. Brain starts forming. When the child is born, 60% of the growth of the brain is completed, but no development we see, growth we see, and the newborn child's brain weighs about 300 grams. So from the day of birth, next 8 to 10 years, the growth of the brain occurs and brain goes to the level of 1.3 to 1.4 kg.
Yes.
So this first 10 years of life becomes very important to learn all emotional activity, then communication, intelligence, interaction, then social roles, all will develop during first 10 years of life. And then polishing of the behavior, polishing of the intelligence, everything that goes on up to 2025. So an autistic child remains so-called normal till the age of 2 to 2.5 to 3 years. So between 2 to 3 years, the autistic child will start showing certain behavioral changes. One is it stops communicating. Already the child knows about 30, 40 words, but will not use the linguistic ability to communicate.
Yeah,
Don't
so
communicate.
That
I'm
means
hungry.
when it was born, it was smiling, playing, everything.
Everything.
Everything. But suddenly, at the age of 2.5 or 3, the behavior changes. Okay.
Yeah, because till the age of 2 to 3, the child smiles at the mother, smiles at the father, then gets attracted when a toy is given. When relatives come, the child responds to their responses. So till the age of 2 to 3, the child looks normal.
Yes.
Parents are very happy, child looks very pretty. But then suddenly child stops communicating. Then cannot show emotions. And then sits at one place, plays to self, takes an article, you give a toy. Next 3 to 4 hours, it keeps on handling the toy and then doesn't bother who is sitting next to it, who, nothing. No speech, no communication, no socialization. Take the child and leave with 3, 4 children.
So it is totally withdrawn from the surrounding.
Yeah, withdrawn from the surroundings. No response to the environmental stimulation. Doesn't respond to other children. Doesn't respond to parents. Doesn't. So we say it lives in its own world, and smile to self, or sometimes giggles, sometimes utters a few words or sentences, but no meaning at all. Then parents get totally annoyed. What's happening to this child? Is the child becoming mentally retarded? Is the child having the attention deficit and hyperactive child? Because it keeps on moving their hands in different way. Yes. Suddenly gets up, suddenly sits down, and then suddenly runs and comes back without any purpose. So sometimes it looks like as though it is a hyperactive child. Or sometimes it's totally withdrawn child, dull child, mental retardation. So in the beginning, even the doctors may have difficulty to differentiate between autism, mental retardation, and ADHD. That's why they come under autism
like
spectrum disorders.
Yes.
So it's a spectrum disorders. Then the child has to be examined either by a pediatrician if he's trained well, or by a clinical psychologist, or by a psychiatrist, child psychiatrist. And there are some tests now designed to confirm autism. Because many times, behavior-wise, it becomes very difficult to differentiate between these three, whether the child is MR, whether it is ADHD, whether it is autistic child, or some other genetic defects. So once autism is established, then the treatment should start. And treatment should continue till the age of 15, 16.
So what is
So
the investigation and how do you make the diagnosis and
no,
differentiate between these things?
psychological testing. No blood test, no scanning, no
nothing.
MRI.
Nothing is there.
Yeah, nothing
So
is there.
it is
Because
the expertise of the
yeah,
doctor
yeah,
himself. Okay.
yeah.
Okay.
Growth is okay, but
Hmm.
development is not there. Communication is not there. Emotional responses are not there. Child doesn't know how to interact with the environment, doesn't know how to interact with people, how to interact with the objects. For the autistic child, men and objects look alike. Men and objects look alike. That doesn't differentiate, doesn't relate to people, doesn't express its wants. Only it goes to kitchen if it's hungry, doesn't ask for food.
Okay.
If it size the cloth, just it pulls the knicker or the shirt, and mother has to understand that it has passed. I want to pass urine. So sign language or no communication. So this type of children, naturally parents get totally alarmed and disturbed. What's happening to my child? It looks so pretty, and it was so good till the age of 2 and 3. Now the child has become like this. So don't get disheartened. Immediately contact a pediatrician who are there everywhere. They'll make a diagnosis, or if they have difficulty, they will refer the child to a child psychiatrist or a clinical psychologist. They will do testing, observe the child, and then say, yes, this child is an autistic child or comes under autistic spectrum disorders. Okay. So once
So
this
what are the differential diagnosis, sir? What are the other conditions that have to be differentiated from autism?
No, all kinds of mental retardation, all kinds of, because they're withdrawn, they don't communicate, and they don't know how to take care of themselves. Here also, an autistic child is not low IQ. The child is having normal IQ or even super IQ.
But not utilizing.
Later, we have seen autistic children becoming super intelligent. They do very well in competitive examination. They become doctors, they become IAS officers, they become engineers, they become scientists. So,
artists,
but
yes.
at a particular stage, they look totally disturbed, totally involved in themselves, no communication. So treatment is three. One is speech therapy, second one is rehabilitation, and third one is teach the child to look after itself and learn the day-to-day activities, bathing, dressing, and personal decoration, going to school and interacting with children, games, learn music, learn. Many times autistic children are very good. They become very good musicians. They become very good artists because their creativity is so good, and their imagination is so exemplary. They become very good artists, and very good academicians also. But only thing is, 10 years of regular, vigorous training by a speech therapist and rehabilitation expert and a psychiatrist. So this has to be done. And so in Bangalore, now there are many artistic children's centers are there. There are many psychologists become specialists in training
Autism.
and autistic children. And there are schools also now, special schools for autistic children. And once they start communicating, they should come back to normal school only. There's no need to separate them. So 2-3 years, they need special schooling and special, because normal school teachers find it very difficult to interact with the autistic.
Yes.
So then once the child is able to communicate, vocabulary is good, able to take care of itself, and its learning speed is very good. It can compete with other children in the school and do well academically. And every child has to be trained to find out his own talent, whether music or dance or any other creative activity. And autistic children, after 15, 16, they join the normal stream of life. So people should not think that, oh, it's due to black magic, or it's due to some God's curse, or what past bad deeds, ನಮ್ಮ ಜನ ಪೂರ್ವ ಜನ್ಮ ಕರ್ಮ ಇಂಥ ಮಗು ಇಟ್ಬಿಟ್ಟಿದೆ. So this is how many parents go into severe depression. I have seen people crying in
they
front
should
of me,
not. They should not.
uh,
Yeah.
crying in front of us, and they expect quick improvement. Please remember, autism slowly disappears. Slowly
Yes.
disappears. I am using the word disappears.
Hmm.
It becomes a normal person. Normal person. Only thing is,
You have to have
parents,
patience.
teachers, and
Patience.
others should help the child to communicate, to learn social interaction, and then lead a normal life, join a normal school, and continue his studies. And drugs have no role. Only if there is hyperactivity, we can prescribe a minor tranquilizer or tamoxifen and such other drugs, hyperactivity. Otherwise, autistic children do not need any
No need
medication. It's only
medication.
training, education, and then teach them emotion skills, teach them speaking communication skills, and the child will develop into a normal individual. This has to be understood by all people.
Yeah, yeah. In fact, one of my associates, no, she later on became a cardiologist, and my student, her baby went into developed autism. So all the way she came from North India to get treatment in Bengaluru, because Bengaluru has become a hub of
Yeah,
treatment
no,
of
all
autism.
medical
Yes,
services. Yeah.
yes, yes.
Good quality care and good doctors are there. Whereas
Yeah.
North, we get a general complaint that they're not very friendly with
Autism clinics are there. Autism clinics are there.
the clinics are
Sir,
the clinics are
any
there.
diet or anything else has to
None,
be
none,
followed here, sir?
nothing, nothing. They're like any other normal child. As the other child requires nutritious food,
But usually to
more fruits,
reduce the
more vegetables.
hyperactivity, they don't give the sugar or the sugar
No,
content, so that
no,
the hyperactivity will come down with that.
no diet, no special diet or specific dietic limitations are not there.
Okay, sir.
They can eat anything what the family is eating, the other children are eating, and they can get involved in all the other activities of the family and environment. And the autistic child can go into a normal individual, and that's the good news about autism. Earlier,
Yeah.
the people didn't know what to do, and they remained autistic throughout their life. Autistic throughout their life, no communication, nothing. Now, with training, they become almost normal individuals. Nothing to worry.
Okay, sir.
Nothing to worry.
Thank you very much, sir. So you have given the three mantra. One, not to lose heart.
Yeah.
Have patience and then they can. And the second thing, the patience and training, perseverance is extremely important. And the third thing is, there are no medicine, nothing, and nothing to worry about it, and they can be all right. So thank you very much for so clearly explaining what is autism, and you have given a new hope for the parents not to worry about it. Thank you, sir.